Barbados has recorded over 50 confirmed cases of the COVID-19 virus. In other parts of the world, the number is much more significant. We spoke with a Barbadian nurse working in the United Kingdom who has since contracted the coronavirus. Wow. And in terms of your diagnosis, when would you have been tested for coronavirus, and what are some of the symptoms that you would have experienced?
Yeah, I had the abdominal pains in my legs, a big urge to go to the toilet and stool. And after speaking to the team now that are doing research for the World Health Organization, that symptom has also been mentioned before. Not everybody has the temperature. Excuse me. Not everybody has the temperature or the cough. And that is why it is such a lethal virus. It mutates so much that people just, it's very hard to pick it up until you've got it, you know, and you don't want to be on this side of it. You really don't.
So what was your reaction when you found out that you had the virus?
I sort of guessed when they did some of the blood tests, and my blood gases really were not improving. So my oxygen levels in my blood were not improving, which really meant my lungs weren't functioning as they should. So they have to give you oxygen to help. And then another test they do, which is like for testing to see if it's bacterial, because bacterial and viral are two different types of organisms. So antibiotics do not work for the coronavirus. It is not bacterial. And so those results were coming back normal to say that I didn't have a bacterial infection. Yeah. And so I knew the last thing to be ruled out really was viral. And if it was going to be viral, it had to be the coronavirus. Yeah.
Wow. So as a nurse, were you mentally prepared? What was your state of mind after going through all those checks? Did you prepare in your mind that you knew that this is what it was?
Yeah, I thought about it. I sort of calculated things in my head throughout the day, you know, and believe it or not, I was fortunate and blessed because A&E was actually more or less empty. It was actually used as a true accident and emergency. It wasn't overspilling with people who use it instead of going to a GP surgery. It was actually emergencies. So when you go straight through and you get seen by quite a few doctors and anaesthetists, you know that you're sick. Once you see an anaesthetist, you know you're sick, and there was enough of them. But yeah, I just feel that I can't emphasize enough: stay at home, stay away from anybody who is not in your dwelling. Stay away from everybody and break your transmission.
What are some of the symptoms you're experiencing now? Are you experiencing shortness of breath?
Mainly shortness of breath, tired, lethargic, lack of appetite. Some of the medication now is making me feel hot. But yeah, I still haven't got some of the symptoms that I have: the headaches, I have backache, But yeah, I'm not too bad. I'm in a room by myself with a commode. Yeah.
Do you have any idea where you would have picked it up from, or have they done any like contact tracing?
I suspect that it was from the football match, because I haven't been out really in that week. Hadn't been out. My son went to a football match. Well, he didn't go to the football match. He went out the day after the match. His friends became an uncle, and they all went out to celebrate. And then I think that's where it happened, even though I did tell him don't go out.
And has anyone else in your house tested positive, or have they
They will do. My son and my husband both basically they've got a cough, but they are symptomatic wise, they're mild symptoms. I think if I didn't have asthma, I think my symptoms would be less severe.
And we are facing a situation here in Barbados where we would have just entered into a 24-hour curfew, and the situation just before the curfew, people were bottlenecking at supermarkets and rushing to get last minute items and not practicing proper social distancing. As a nurse and someone who now has the virus, what would you say to Barbadians who may not be taking this as seriously as they should?
To be honest, sad to say, but someone will suffer. You know, and the sad thing is people think it's not going to be them, you know, but someone will carry the virus somewhere, unfortunately, you know, and it is life-threatening. At the end of the day, unfortunately, you know, people can cook, and you're going to have plenty of time to learn to cook. That is, the world is resetting, you know. People always have food, you know, in your cupboards. Our grandmothers cooked with less and survived. And basically their generation are older, wiser, and probably healthier than most of ours today. So it can be done. And basically it took so many lives. There's a lot of healthcare workers who've died, doctors, nurses, healthcare assistants, porters, and I don't think people outside realise how hard people inside the hospital setting are to try and save people's lives, you know, and I think all they have to do is stay at home and break the transmission.